How are you, everybody? Yeah, I'm glad you all came with the snow and everything. And yeah, we got to get into this thing nice because of the a lot of people who come in to see us for diabetes, because the western side there's no help for that because of the insulin. The recommended medications are insulin, metformin, diuretics, that kind of thing, but it's not going to cure the diabetes. But you have to find the Ayurveda margins, like what can you do, what can't you do with that, because every diabetes we can't cure. Some we can, some we can't. And after you learn from this lesson, you can understand what kind of diabetes we can cure, or what kind of diabetes we can be managed, or what kind of diabetes we can't, the incurable one. And these two things, if you identify, and you don't have to claim to the other person, "Oh, I can help you," because you wouldn't be able to help some people, and at that point, if you're going to help with that kind of conditions, you're going to damage your reputation, because you saying something is definitely, Ayurveda say, incurable, and you're going to deal with that, and that is not on. Okay, and then be honest with the patients what you can do and what you can't do. But any diabetes, like even incurable one, even curable one, is a diet play a big role. Diet play a big role, and that means in a way you can help them with the diet and lifestyle and quality of life. It's like sometimes like a cancer. You can't claim like I can cure the cancer, but you can reduce the sign and symptoms, about the unnecessary sign and symptoms. When you come into the diabetes, and diabetes bring you loads of complication, loads of complication. If somebody has diabetes, mean you invite for the whole set of diseases, and that mean it come as a complication, or because of diabetes they have that condition. For example, diabetes retinopathy, and is affected to eyes, and the retina is detached from the eyeball, and it can come like a complication. You can have with that, with the changing things, and diabetic neuropathy. And neuropathy mean is peripheral neuron system, that superficial neuron system is affected, and then people have peripheral neuritis, that mean tingling, numbness of the fingers and toes and that kind of thing. You can help with that kind of thing, and after knowing this subject, you can help a lot of things associated with diabetes, and same times diabetes to under control. For example, a lot of people come into us, the margins of diabetes, they have some kind of margins in their head, because doctors ask them, you diabetes, if you have that much or this much. And it is like, if you listen to some patients saying, my sugar level is 5.5, and it is okay. Under 6.5, they don't know what it is. It's a glucose level. I will go through a whole thing, but the patient would come and say, my glucose level is going 16 to 20. Sometimes 16, sometimes 20. When I have the metformin or some medication, it come in 10. And that is like a typical kind of diabetic patient. Okay, because it's like they're having the metformin or insulin or something like that regularly, and it keep insulin the glucose level to the 10. But if you're not having insulin or metformin, it going more than 16 to 20, and then more than 20 to 16 it's going, and patient present with the different sign and symptoms which they knows, and their vision is disturbed, their balance is disturbed, and they are getting very tired and thirsty and urinate a lot, and these kind of things appear to the diabetes patient as a diabetes. I'm not talking about normal person. It is diabetes person who come in to see you. We have to have a kind of proper understanding, how do I see this, normally people don't come to see you, I'm going to have a diabetes, you see, not like I don't have diabetes, I will get diabetes. This kind of, very rare. Sometimes, people have family histories and they think, my mom and dad both diabetic, I don't want to have diabetes, and then I will going to find a prevention. And it is different kind of patients, and very rare people have precautions. And instead of what that they do, my mom and dad have diabetes, and instead of prevent from that, I can have as much as eat I can do when I'm not in. Sorry?
Because I'm going to get it anyway.
I'm going to get anyway, as much as I can eat sweet, and I can eat in my non-diabetic time, and that they will get diabetic anyway, because it's giving you a red flag in a Western allopathic medicine. If you have your family history diabetes present, you clearly going to have there is big chance of you going to have a diabetes. And what people is believing that stuff, what they're going to do is not prevent, have more, and before I get to diabetes, I can eat as much as I can, and lots of Asian people like that, anyway, I'm going to get a diabetes because my mom has diabetes. And then it's like, backfire on them. They might have genes, but if you don't have that kind of attitude and lifestyle, they might prevent from that. But it is the how they mesmerizing us to believe you're going to get it, and then whenever I go to doctors, I hardly ever goes, is menopause time or something like that. When I went, they asked the family history. My father has diabetes, my mother has high blood pressure. I knew why they have that, because as soon as they go to doctors, they presented by the pills, and then as you could do, my father is really good, and he's managing, he's 82 now, 82, he's managing with the Ayurvedic medicine, is keep the Western medicine aside and looking at them and taking the Ayurvedic precautions, and he knows how to handle it, and he never got to that point anything happened to him, because he knows how to handle it, because he got the knowledge from Ayurveda side and lifestyle and dietary advice and everything. He managed really nicely, and he is not having any complication. And as a the 82 years old man who has diabetic from the 48, and he's managed really nicely. I said to you why he had, I think I did said to you, see, and because his history, because he's completely Vata type person, like much more than me Vata, and he's quite mad Vata, like really nice, like me and him, we get on really well in every ways, because why I know the Vata, how it works, and from him, and really nice kind of Vata constitution. And then he's never put on weight, he never had any bad habits, or he eat really well, and he have a lot of physical exercises, like he used to work in a police department, and he's run after rogues and everything every time, and then he hasn't got any a point to him to get diabetes in that age, you see. Vata type, he hasn't got any family history. His mother and father haven't got diabetes, and this is like completely bizarre when he has diabetes, and then what happened was, he was working in police at that point, and then he has a punishment to get somewhere, some kind of minister's bodyguard, and then whenever the minister is very fat and very ate a lot of things, he might have diabetes, and at that point Sri Lanka, now I'm talking about 40-50 years ago, I think 40 years ago, and they introduced Coca-Cola to Sri Lanka. That Coca-Cola is like, now it's McDonald's. Now McDonald's is very, very popular in Sri Lanka. Pizza Hut, McDonald's and KFC is like if somebody going there is a rich, high class people going there, upper class people, and they going to, here we thought it's a poor people going to McDonald's, is it? Oh, people don't have that much of money. But in Sri Lanka, India, still the rich people go to McDonald's, and because they're very expensive, and it is Sri Lankan meal is like 100 rupees for good rice and curry. You can have 250 rupees, and one pizza is 2,500, and people go into that, the ditching the good rice and curry, going to the Pizza Hut, this crazy pizza, 2,000. Somebody's, how many, somebody's, day salary is they giving you to the Pizza Hut, like good, the upper class people, and that's how now Coca-Cola and, the pizza. But those days, 40 years ago, Coca-Cola is like that. I never have seen Coca-Cola in my life until my father said, is that really? And because in those days, Sri Lanka, they have that drinks like, normal fruit drinks, like, orange juice, or the apple, not apple, this all the banana, mangoes, this kind of things. People don't do juices because there's a lot of fruit available. People eat fruit. And what happened was introduced Coca-Cola at that point, and then every opening ceremony, my dad going with that fat politician, and he asked, oh, Mr. Rodrigo, this Coca-Cola is very good, like it's coming from this thing, it's very expensive, you can drink it. And my father is drink every meeting he goes, and he has drank the Coca-Cola, because he doesn't know it is coming from the, and after 2 months later, my mom found out, because it's when you have the urine in the sugar in urine, your house full of ants. Everywhere they're smelling the sweetness, and it's like not that it's a black ants. We call it there is a white ant and black ants. Black ant is very looking for sweets, and it's innocent one. Like all toilet around everywhere is some. Then my mom said, somebody has sugar, somebody has diabetes in this family, and then that's how he predict. And then most probably my dad, because by normally that age group, and then they found out he got diabetes because completely due to Coca-Cola. It's nothing else, and he's Vata type people. He wouldn't eat that kind of rubbish, and he's not eating any fatty food. Anything is there, and but still lifestyle can give you that, and then when they see the diabetes level is too high, because Coca-Cola has so much sugar, is it? Like if you drink 3-4 bottles of a little Coca-Cola a day, and you can't imagine how it's going to be, like in poor him, and then what happened was, when he found out, he's like a coma level, like it's really up, is 25 to 40 or something, and really high, and then he has to put into insulin, and then the metformin and everything, and then I think his life is ruined by that drinking that Coca-Cola, and you can sue them, but what can you do? You shouldn't drink that much. That's what they will say. And you can see like how much damage can be done in drinking this sugary drink for the children and the young adult, and that's is the main problem of diabetes. The sugary drink, Coca-Cola, Pepsi, like
Ribena for children.
Ribena, lot of sugar.
8 teaspoons of sugar in each carton of Ribena.
Are
Eight.
the energy drinks the same?
Energy drinks the same. You
What
know?
about, like, because nowadays obviously they even Coca-Cola has gotten onto it, so they make it no calories.
Yeah.
It's all the artificial sweetness
Yeah.
without having the
Artificial sweetness is the same.
Same.
Yes, same
As far as
is
diabetes is
as the
concerned.
diabetes concern is sweet because it's
Sweet.
whatever the energy produced, and you can see that when I'm going to explain how the diabetes come in. And as far as is the glucose, there is the whatever the form without a sweetener, without calories they're called,
Yeah.
but they still induce the dhatu to get the sweet out of the channel, like kind of it's a concentrate something you can take some kind of excessive sugar out of the channel, and that means a diabetic person anyway. And then the thing is, before that we had used cane sugar, coconut sugar, and sugar beet sugar, and this is sugar is not bad, is you need that. It's a small amount of to your body, and without sugar your body wouldn't function. You need sugar. People say I cut all my sugar. It is not good either. But like the thing is, this hidden sugar we have. If you have a donut or something, if you have a chocolate, or if you have a so much sugar in here, and without knowing, you have 8 to 10 teaspoons of sugar you have consumed a day, and without knowing, even without knowing, like a bread, they have sugar in the bread, and they have sugar in the buns, and this whole thing is like, even it is breakdown to sugar, and that means it is getting double the amount of sugar to the body. And
what about things like alcohol?
Alcohol.
It's like obviously because the yeast
Yeah.
supposedly took some of the sugar.
Yeah.
Is it still
Alcohol is a funny way. It doesn't go through whole dhatu level. It's going to the Uddaka Vahashrotas. That means, it's coming to the water channel, and it doesn't go to the dhatu because of the ashukari we call. It's like absorb quickly, and doesn't go to the. That's what when you have one glass of wine, within 10 seconds you feel it, and when you eat a food, you don't feel within 10 seconds. It takes 2 hours because it has to cross the dhatu level. And then good thing about alcohol is not good, but good thing about alcohol sugar is getting out of the system very quickly. Like if you have a beer, and within 5 minutes, what they're having 10 minutes, they want to go to urinate, and that means sugar is not circulating whole way through, and that means alcohol sugar is less affected than the fruit juice, and the other juices, like Coca-Cola doesn't go that way because they don't have the ashukari, the alcohol, the circulation quality, effect of penetrating through pretty quickly, and Coca-Cola doesn't have that. Coca-Cola has that, because they taken this out, and then they bring is like sugar into that to go into the dhatu system, and then when you float into the dhatu system, and it is like crossing the rasa, rakta, mansa, medas, asti, majja, shukra, and that means everywhere is polluted, and alcohol hasn't got that effect. And in a way, alcohol is much better than fruit juice. Crazy. And that's what is, long time ago, people drink a lot of alcohol. They didn't have diabetes. You see? You go to your ancestors, your forefathers, especially the Irish culture, they are drinking too much alcohol, but they don't have diabetes. Instead of Asians have diabetes, they never touch alcohol. You see, some people never touch alcohol, they got diabetes. But the when you go into statistics, Ireland is quite low in diabetes. Is it?
Scotland.
Scotland,
But
sorry.
yeah.
Yeah, Ireland, yeah.
Glasgow with our Yr2.
Yeah, when you go to north, because it's a cold, people used to drink a lot of alcohol because that's their, one of a prevention method. When you have hot drinks, you feel like warm, and it's make them better. Sorry about that. Ireland, Scotland, everything for me is like India, Sri Lanka, Pakistan, Bangladesh. Everything is for me is same. And then this kind of I think it's like, I'm not promoting alcohol, but alcohol is, Ayurveda says alcohol is useful sometimes, rather than the fruit drinks. And the Ayurveda says in a sloka, Nava Annapana, that means salad, fruit juice, avoid salad and fruit juice for diabetes.
Why avoid salad?
Water content, and then because it's like when you're going to explain everything, it's a beautiful story about diabetes, how it's becoming like diabetes, this why is that kind of thing, okay? Why the diabetes present in somebody's body? Yes.
Got a couple of questions. Kay Britt asking, how about the syrups, for example, lime and soda, whether that's good? And again, jams which has fruits.
Yeah.
So that sugar, whether it's good?
Yeah. Jam, those days, how we made a jam is the fruit jam, the sucrose is there, is it? Fruit is preserved, not put in a lot of sugar itself. But nowadays, like fruit is less, sugar is more. Like those days, why they had jams and fruit kind of thing, to what do you call keep it for preserve for the winter. Like they don't, if the strawberry, apples, pears not available, they haven't got a fridge, they haven't got any way to keep the fruits, eating of fruits like sucrose. And then what they have done those days is preserve the fruit with sugar, the preservative factor is the sugar, and more sucrose is there. Sucrose and glucose is an equal amount, and it is breakdown in different in a body. But nowadays is when you come to jam, is much more sugar, and you don't know what the sugar they eat using as well. Sometimes sweetener, sometimes sugar, and then this is quite a bit of. If you made a jam yourself, and it is not too bad. And again, jam you can't eat a lot. Is 1 teaspoon of jam too, like 2 slice of bread, and it is how much sugar in there. But when you drinking a Coca-Cola, when you drinking fruit juice, and without knowing 1 glass, you have 8 teaspoon of sugar. And even you saying in supermarkets, fruit juices like pure, orange juice, see how much is sugar, pure, and then you can see the bits floating around, you can feel the yellowness, and you can feel all the good thing. And I sometimes buy, and then I think when I see that for the children, this is not very good, like there is a lot of sugar in there, and without knowing, we are consuming a lot of sugar.
Even the juice that has no sugar?
Sorry?
Even juices that have no sugar?
Yeah.
They have sweetness.
Sweet.
No, but
Well,
you can
fructose,
get juice.
It's 100% orange juice.
Yeah, like apple juice that there's no sugar in it. Is
Well,
that still bad?
I think it's like how could they make sugar? If you crush the apple and have a juice and see how the taste is, and how the juice tastes, and it is very different. You can't make a juice without a very sweet, whatever the sweetening agent, you have to put it there. But I don't know what the meaning of sugar free, but still sugary. Everywhere, I have no idea what is called as sugar free. And then, you know, when you drink, it's a completely sugar. And some kind of advertisement, you know, some kind of labeling, you know, like we do labeling now. Oh my God, the loophole we have, you know, to get it to the consumers. You know, you can't claim like that, but you can claim like this. You can put label like that. You can't, because it's a direct influence, but you can do the same thing like that. You know, paraben is everything has a paraben, and but what it, they have different name for the paraben, you know, like and then paraben free, but these chemicals are there, and they paraben free mean, yeah, you know, the name free, but these chemicals are there, you know, and like that they take the even the monoglutamide sodium or something like that, what a Chinese food, MSG has so many names. You don't know, you might have MSG in your diet, you don't know, because so many other the synonyms, and when you use that, people, the consumer can you know, cheated by this kind of thing. And you know, you have to be really careful about, you know, what you're eating, especially with sugar, because so many things has, you know, especially your children, you know, if you make a nice food in a house, homemade nice food, you can say is what you're putting. Even if you buy a bread in outside, you don't know what's in it, you know.
Because I saw a really interesting program on TV some time ago talking about the problem with fat in diet and the problem with sugar in diet. So this is some years ago when they discovered that there were problems. And apparently the sugar lobby was so strong that they quashed all of the evidence to say that sugar was bad, but it was all around, you know, fat was the bad problem. So they had all of the low-fat products that we have now are as a result of this. But actually what they do in the low-fat products is they put lots of sugar in to make the taste better. So it's a disaster. You know,
and all the low-fat products, you know, is the sugar, a high content of sugar, less low fat.
But it's actually even
worse. You know, and if people eat fat, is that body doesn't know how to break down. But if you have some form of sugar, body doesn't know how to break down, and it is like absorbed to the kidney, and then whole function is going haywire. And then that's what I say, alcohol is much better than fruit juice. You know, crazy, but that is the truth.
Well,
you know,
in medieval times, everybody drank beer for breakfast, lunch and dinner, even children, because beer was safer than water. What about stevia? That is supposed to be a natural sweetener. It comes from a plant.
Yes, but
and it's very, very sweet.
Very sweet, very sweet, and it's a flavor. But you know, like still that when you go to the dhatu level, they identify the sucrose and glucose, and if it has glucose, whatever the taste is producing much more glucose, and it is like again similar kind of problem. And stevia, when they have that, you know, it is good for the diabetes, is it? They ask you to.
It's supposedly better than sugar, but I don't know if it's good.
It is a chemical though. It is like the
it's
chemical
extracted from a plant.
Because I used to grow the plant. We used to have it, you know, just growing in the balcony, and we used to put it in tea because it was just a green leaf.
And it is sugar. It tastes sweet.
But obviously, to put it into food, they have to process it. So the processing is not
and beetroot is sugary. You know, beetroot. If you eat beetroot, is really sweet. And
black strap molasses, they say it's good for diabetes.
And that's what my dad has in Sri Lanka. You know, it's called kitul tree. You know, like a big tree. You know, like I say sometimes. In like it's a palm tree kind of thing, and we extract the sugar from the thing from the farm. Somehow we made the sugar, and that one is less calorie, sweetener only, and this is my father is eating that one normally, and it is very good. It doesn't produce the sugar level high, and it is keep the sugar the level low. I don't know, it's now people found out loads of extract, sweet extract, the what you call property. They taken the properties out, they make in like sweetener, and how they feel into tongue, sweet. How you have to feel, where you have to feel it, tongue, mouth, and the palate. And if you feel something to the palate and it hasn't got a calories, and people think that is really good, but they don't know when you go inside, like what is doing to the other component. Like you have drinking a cup of tea with the stevia or something, natural sugar or the sugar, and you same times you have a piece of bread, and what the sweetener is doing to the piece of bread, you don't know, is together, and this going to be as a mess in the body. And anyway, we will go and find how the diabetes work, how the diabetes is in Western, under the Western the eye, and the Eastern the Ayurveda eye. Okay, and this in a allopathic way, Ayurvedic way is called Meha Roga. Meha means Meha. What is the roga mean? What is the roga? Diseases. Meha mean that normal function of urinary tract. Like a fluidity of, or the normal function we call Meha. Okay? Roga mean whatever happen into the normal function, it is called roga. Meha roga. When you go into Charaka Samhita, it is saying, you can find the chapter Prameha Chikitsa.
Sorry, which book was that in?
Ashtanga De.
Okay.
Ashtanga De, if you go into Prameha Chikitsa. Okay, and that is the diabetics chapter. Okay, Meha Roga, Prameha mean correct, normal function of urinary tract, whole urinary tract system. Prameha mean abnormality of the function of the urinate. Okay, Chikitsa mean treatment, and that's what is a two different way they explaining. Some book says Meha Roga Adhyaya, that is all the same. Meha Roga mean if it is a Meha, it is a disease, because a disease and you have to cure that disease. Prameha mean abnormal function. Abnormal function, it is the Chikitsa, like treatment has to be happening. And I'm just saying, when you're going to why I've said these two different names, sometimes you can get from books, Prameha or Meha. Meha mean normal function, Prameha mean abnormal function. If it is abnormal function, is a treatment. Meha can be, Roga mean can be disease in a function, can be disease in a different way. Meha Roga, like kind of thing. And this, otherwise you will ask me, why is Prameha, why is Meha is like explanation Prameha of Prameha mean that. Okay, and prameha means
So is it always the normal function of the urinary tract, or just normal function?
normal function is meha. Everywhere, like if you have meha, like meha means normal functional irregularities or the disease we call meha roga. Normal function is irregular person. With a person we call meha roga. But prameha chikitsa mean already the problem, and then chikitsa is already a problem. That means you have to do a treatment. Okay, and these two, under these two chapters, these names, you can find diabetes in any books. Okay, either meha roga, either prameha chikitsa, and this is all called diabetes. You're going to find out diabetes. This topic can pop out, and don't worry about that, which way it is that, and then you can understand what is the meaning of that. Okay, and if you don't, if you want to know about a lot, ask Gabriella what is the difference between these names, and then she will explain. Prameha mean like excess, excess mean like irregular or too much is called prameha. Too much of something, too much urine going, too much of sugar, too much of everything we call prameha. Okay, and go to the allopathic point of view, and allopathic point of view, like anybody suffer from diabetes in here, or anybody has your family or friends suffer from it, yeah? And who's yours?
Well, my uncle actually, he died from it a while ago.
Okay. How old when he was dying?
He must have been mid-50s.
Mid-50s, okay.
He
And that
lost
means,
his leg.
okay,
Yeah.
leg amputated.
Same.
Yeah.
My
He
grandfather.
died, he never recovered from it. He
Never.
died in the hospital a day later.
Okay.
It's just too much.
You could have a little bit of contact with my dad. He will tell everything about how to prevent from that, because it's like the long, like it is some kind of method you can prevent from that, and then you.
Yeah, mine was my grandfather.
Yeah.
Also had diabetes, and he was going to have his leg amputated, but he
Yeah.
actually died before they did it. But obviously.
Oh,
it was,
okay.
but he was old. He was in his 80s, 90s.
80s, 90s kind of thing,
died,
yeah. And this is this young fellow,
Yeah.
when he died, like it's 50 some. A lot of people are dying 50s. When you have, they're saying when you get affected in the 30s, late 30s, you would die in 50s, because that's the 20 years of jolly time they give you, and then they're saying this complication can come and you can die with diabetes, kind of thing. The leg, the infections or heart failures or something like that, if they can die. Anybody else has family histories? No. And it's the thing is, lucky you, family history, because I know my dad got the diabetes, but I know my family history is not there. It's because of external cause putting him diabetes because of the excessive drinking of Coca-Cola, like some period of time. And that kind of thing is like if I go to doctors and my doctor said, okay, you have family history, you have to be careful. And I know my family history is pretty good, because it is not coming from the gene. It is coming from the excess use of some kind of sugar. And like that, if you have a really little bit understanding about why he had, that can I have the same thing, is you can exclude yourself from this, like they're saying, you might going to get diabetes. And your uncle mean your blood relatives? No, okay. And he has quite mild diabetes, so you see why he had the diabetes. Is he drinking a lot or something?
No, he wasn't. He used to drink just black coffee and smoke cigarettes all the time. He was under a lot of stress.
Yeah.
I don't know. He lost his wife. She had like a kidney disease, and then he was stressed.
Yeah, stress.
I don't actually know exactly
No,
what
that
I was
much.
I was quite young
Yeah,
when he died.
okay.
But he wasn't like, you know, what you would think a diabetic would look. He was quite thin.
Yeah,
Yeah, he didn't eat much.
much, yes.
Just smoked and drink coffee.
Yeah, that is the Vata type, you know,
Yeah.
and Vata type is quite incurable, and then
I mean, he might have had, you know, sugary things that I wasn't aware of.
we are off.
I
Yes,
don't
yes,
think he put sugar in enough coffee.
yeah, yeah.
Because you can get some people, like my dad, he had a lot of sugar, he drank Coca-Cola. He worked for Coca-Cola actually. And, but he didn't get diabetes.
Yeah.
But then he had a heart disease. So
Okay.
it's funny how some people
Yeah,
develop diabetes
Yes.
and some people it goes to the heart.
heart,
So
yes.
that depends on the constitution.
Yeah, depend on the constitution. Yeah, depend on the constitution. And you can say which dhatu is involving. You can go and we can see that. Okay, and is allopathic point of view is a lifelong condition, and blood sugar, level is become too high, incurable. Only can be managed. Okay, and then if you have a diabetes, people say, diabetic mean person who has diabetic, and people call, I am diabetic. Diabetic means person who has the syndrome called diabetic, and diabetes mean the disease itself. Okay, and lot of people is like wearing like some kind of necklace. I am diabetic, and then that means we have to differently treat for them kind of thing. But it's a lifelong condition according to them, and then always blood sugar high, and they have to have managed with some kind of medication to blood sugar to be in a level, and incurable can be managed only. And two main type of diabetes in allopathic point of view, type A and type 2. Type A is pancreas doesn't produce any insulin whatsoever. When you go to the type 2, pancreas doesn't produce, or body can't identify if the insulin is some people's pancreas is perfectly okay. When you go through the test and it's producing the insulin and it's perfectly okay, but body can't understand this is the insulin, and that's called type 2. And when you go to the, sorry about that, I will go to the, you can see where the pancreas is, like the esophagus and the liver and gallbladder and stomach, and just below the stomach, in between the transverse colon, you can see pancreas or spleen. And what is the Agni is in there we producing? Klomagni or Panchabhuta Agni. Klomagni is the Panchabhuta Agni. Okay?
I thought Panchabhuta comes from the liver.
No. Liver and not liver that much. Klomagni, liver and spleen together always we call Klomagni. Panchabhuta Agni. Klomagni is like what you're saying is from the liver, but Panchabhuta Agni mean is both together. But stomach is, what is the stomach Agni? Jataragni. Jataragni is one single, whole enzyme come from Jataragni liver, and the Klomagni and liver, like Akma we call Agni together we call this mostly is what are the liver enzymes is coming to the gut? All the protein, all the breaking down protein kind of enzymes come from liver, is it? Yeah. And the breaking down sugar enzyme come from spleen, insulin, and these two together is like, because you have that the very good thing is like when you drinking a fruit juice, what happen? Fruit juice, fructose can absorbs by
esophagus.
esophagus, upper part. Okay, it doesn't matter that much, you know. If you use fruit juice sugar, and can break down there, it has to have a chlomag, you know, and that's the difference between the fruit and the sugar.
So natural sugar can be absorbed in the esophagus.
Esophagus, and then because if you have sucrose in a Western way, we call fructose and sucrose. Fructose can only can absorb by esophagus, which is consist in fruits, you know, like any apple, pears, any berries, mangoes, bananas, everything. The sugar, the fruit has absorbed by the esophagus. But if you eat fruit juice, fruit, you know, orange, you know, you put 2 oranges, you squeeze the 2 oranges and add 2 teaspoons of sugar for that. What happens?
There's too much sugar.
Absorbs fructose in upstairs. Sugar is coming to the downstairs liver. Until chlomagni is stimulated, that sugar is not breaking down.
So chlomagni comes from the pancreas.
Pancreas and insulin. Chlomagni means insulin, you know. But people think is I have sugar drinks, you know, like I have drink orange juice and it is absorbed by my esophagus and it's a sucrose. Yes, the fructose all absorbs by the esophagus. But if you put 2 teaspoons of sugar, glucose is until coming to the last bit of digestion. You can understand now why sugar is not good, why is fruit juice is good. Fruit.
But they say that when you drink fruit juice,
Yeah.
Your sugar levels in the blood
Yeah.
spike nonetheless. Because they say that it's too much
Yeah.
sugar.
Because
in
the
a
added
fruit
sugar.
juice. No.
Added sugar.
Not
Added
because of
sugar.
added sugar.
Yeah.
No, without any added sugar.
Sugar. Okay.
Just pure fruit juice.
Yeah.
They say that your blood level,
Yeah.
your sugar in the blood level spikes nonetheless.
Yeah, and then research found out in India. I haven't got there is paper published in the Indian university somewhere. Only eating fruit can cure diabetes. You can cure the diabetes because only, you know, they think they use the grapes, you know, the 1 kilo of grape they have to eat every day, and
That's
then they
quite high water content as well.
water content as well, and then it's absorb all the sugar, sucrose to the glucose to the fructose, because
Yeah.
it's the same kind of element, you know. And the paper published, but it's not published in the world because of the people will cure the diabetes then. You know?
What about the drugs?
Yeah, without the drugs, you know, because it's a fruit is curing the diabetes, and they go one by. I go into the paper and I see it's like really good explanation. It's not that the Ayurvedic to give, and it is like scientists.
Can you share the paper?
You can Google it. You know, like say the Indian research papers. You know, fruit juice cure the diabetes or something like that, and you can get it the paper, I think. And the gallbladder, you know, like these all 3 things: gallbladder, liver, and the what is gallbladder do? Ranjaka pitta. You know, give you the bile. You know, like acidity level. You know, to bring the color. And then the color to the blood, color to the poo, color to the everything, plus is break down the some protein, actually gallbladder, you know, like protein and the lipid kind of thing. Mostly lipid, gallbladder, liver is the protein, chloma is the glucose. Okay, three things, you know, glucose. I'm not talking about fructose, okay. These 3, if you have a meal And for example, if you have chicken and rice, and is there fructose there? No. But it has protein, carbohydrate with 2 sugars, carbohydrate with sugars, that's what it's called, and fat. And then these 3 things digest by Panchabhutagni. Liver is protein, gallbladder is lipid, and spleen is sugar, which carbohydrate. Okay, and if you don't go to that kind of theory, and if you go into the practical sense, if somebody has diabetes, more than sugar, what they have to away from? Carbohydrate, bread, rice, and that kind of thing. As soon as they take the white bread, rice, or some kind of like any carbohydrate thing, they straight away the blood sugar is going up more than sugar. Because sugar is like a breakdown form. If you eat 1 teaspoon of sugar, is breakdown and easy to break into the digestive process. But if you have 1 or 2 slices of bread, they have too much carbohydrate with sugars. Then some labeling is calling carbohydrate with sugars. Is it?
Yeah, carbohydrate is sugar.
Is sugar.
Yeah.
But they don't say that very much. Carbohydrate means people get different idea. See, if you have 5 teaspoon of sugar, sugar. If 5 teaspoon carbohydrate, that's fine, and it may 10 teaspoon. Yeah, same 10 teaspoon of because its breakdown is going more sugars. And that means carbohydrate much more worse than sugar. And what they going to give us is like the presenting with like carbohydrate with little bit of sugar and say this is sugar free. And this glass of little sugar with some kind of bread, they say this is sugar free. And what happened in the body is breaking down all the, and in that case what kind of carbohydrate you have to have then? Slow release carbohydrate.
Low GI.
Low GI, yes, science, yes. Yes, it's good, yeah. What is it?
I've just looked up the carbohydrate molecule. The reason why it is a sugar is because part of the carbohydrate molecule is glucose.
Yeah.
So that's the thing. People forget that
actually sugar is...
They think it's something entirely different. And it's the same.
Same. It's more worse than same, because it has to break down and calm the system, and then digestive process is going through, and it is coming like more the sugar than the normal. The carbohydrate become more sugar than the normal sugar. And then whole thing is, people don't know this. People think carbohydrate is different thing, sugar is different thing, protein is different thing. But when you come into this, the whole Panchabhutagni, it's like whatever you take in from the carbohydrate, protein, and lipid, they break it down and make in the 5 different elements. 5 different elements. But they don't go that far because they can't understand that bit. But when we come into the Ayurveda, we say this is liver, gallbladder, and spleen together is called Panchamahabhutagni. Is this Klomagni there, but Panchamahabhutagni, which helping protein to digest, carbohydrate to digest, with sugars, and lipid to digest. And with 3 things is essential in a diet. You see, carbohydrate, protein, and if you eat something, carbohydrate, protein, and lipid. You see, you eat in that, and plus what you have in your food, vitamin and minerals. Vitamin and minerals. Where's the vitamin and minerals come from? And if you eat tons of spinach, vitamin mineral comes from. Or if you had loads of fruit juice, if you have vitamin C, loads of things you have vitamin minerals like kind of thing. What happens? Where is absorbs? For example, if you're eating some food with rice and chicken and little bit dal or they think protein, lipid, and with some kind of spinach, like cooked spinach, the little bit slightly steamed spinach. What happening in there? Why we have spinach?
It's got iron.
Water soluble vitamin. Water soluble vitamin. This whole, when you're going to down there, is all fat soluble. It's a water soluble vitamin and mineral is absorbs in esophagus. With sugar sometimes, without sugar sometimes. Fat soluble minerals is not going to absorb in up there. And that water soluble vitamin and minerals, I think ADKE, I think this 4 vitamins, ADK is, and B and C is fat soluble. ADK is the one is water soluble. Water soluble vitamins are absorbed by esophagus. That's how they make a vitamin tablet. What is vitamin tablet? Vitamin C tablet, vitamin A tablet. You heard about vitamin D tablet. I think DKE. Can you check it out from the ADKE is the water soluble, is it? No,
vitamin
fat.
C is for
Fat
water.
soluble.
No, fat.
D, the
C is
B and C is water soluble. Okay, this is fat soluble one is not absorbs in this area. It has to go to the down there. But B and C, water soluble, absorb in up there. And then vitamin C, vitamin B, and what they have done is in the capsule form, this fat soluble vitamin C, ADKE, and put fat and soluble, like a, what do you call that, like vitamins capsules, we have that like oil, that what is that? Omega 3 and cod liver oil, that you put it that one and give it to the patient, and that when you go into the, it's not absorbed by here, it's going to the process in there covered with that, and then when you go to the digestion it will absorb. But vitamin B and C you don't have to cover it. Vitamin C capsule you can eat that, vitamin B capsule you can, not a capsule, you eat, and lozenges kind of thing, because that absorbs by the up there, and this is you should know about this kind of thing, because it's like this is science, not donkeys years ago I learned from the patients. And then vitamin and mineral mean what we doing is like, either if you have the vitamin, that's what I say, if you have spinach and a little bit olive oil and stir it a little bit, what happen? Rather than you eating raw,
Cooks.
it's cooked and it is oily and it is going to the second part and absorb rest of the fat soluble vitamins.
So it's a better way.
Better way to eat.
It doesn't mean you should eat salad.
You shouldn't eat salad. you should eat because it's nothing water soluble. And that means it's a waste of time and waste of effort. And salad people eat because of the crunchiness, light kind of feeling like you full of stomach, you don't have to eat something, and like kind of thing.
What about all the minerals like iron and magnesium?
Iron, magnesium.
How do you absorb them?
it's like iron, magnesium, calcium and everything is very, very little amount you need.
Yeah.
You don't need tons of that. And
But you get them through your vegetables.
vegetable, fruit, and even this process, they will absorb that vitamin, the minerals, you know.
In which part of the digestion? Is
Upper
it?
part, because if you have eating, if you eat,
Spinach has iron in it.
yeah,
isn't it?
iron in it as well. But it has to go through a process of the fat soluble thing, you know, because it has to go to the dhatu level to iron,
So it's a downward part.
downward part. And if you eat a banana has potassium, and that absorbs by the upstairs. It doesn't has to go to the down, you know. And then some minerals rich with some fruits. You know, like if you have apple a day, you can have all the mineral you want, because it's a potassium, calcium, magnesium, boron, lithium, carbon, everything is there in that apple, because it's really little and little thing. But 5 a day, what is it? 5 a day, like people call 5 fruit a day. Is that necessary?
Is what is absorbed by the esophagus therefore not going to the dhatus?
Dhatus,
Yeah, are you saying, it seems like you're saying that if it goes through to the digestion in the stomach, then
Yeah.
it's a superior
absorption to the dhatu level, deep dhatu.
So what's going in the esophagus is not going to the dhatus?
Some are not. It's like a superficial in its urine, and all the vitamins you taken is not going to. That's what they're using it, because it's not going to dhatu level. It is if you excess, and it is going through out of the urine system. You know, vitamin C, if you can have 1000 milligrams a day, but next day what happened? Is going through urine, and it doesn't make any difference to your dhatu level. And anything like any the well woman tablet, when man tablet, and the pregnocare, this whole thing is quite a bit of hoo-ha, you know, because you don't need that much of thing, you know, when you think about. And it is like they take all the molecules, they take all the absorption, some kind of mineral, vitamin and everything, and give you tons. You need 0.00001. They give a kilogram, you need 0.0001. And what happened? Other kilogram is going out of the urine system. You know, it will damage to your kidneys, because kidney can't handle that much of the molecules come to bromine capsules, you know, because it's a sieve there, and it is, if you drink a lot of vitamin capsules, and it is because they know how to do it without damaging the bromine capsule, because their molecules are really small. It's not going anywhere, and that's what is safe to have. Any vitamin and minerals is safe to have. You can go and buy tons of vitamin from pharmacy or the health food shops. They don't say like, oh, don't use it, it's not good. No, you can have tons, and you can have one. You can 0.1 you can absorb, another thing you can flush to the toilet. You know, and it's a whole thing about what, you know, and rather than eat apple. Eat an apple, and your children, you know, like other things. One day, you know, your children, don't give this all stuff, and have natural something. You know, what's wrong with the people drinking juices? And there are fruits available, not like those days now. You know, a lot of fruits available in here anyway. You know, and in that case, you can see, you know, like children being mesmerized by either overloading 5 a days, and children put off by the eating fruit, because mom's running and giving you 5 a day, and you don't need that. You have one piece of apple is doing a whole hoo-ha, and that is like overloading the system. Okay, and a little bit wanted to show you what's happening inside where the fat, glucose and not glucose, the protein, carbohydrates absorbs, and which becoming in Ayurvedic ways Panchamahabhuta. Panchamahabhuta, ghost form of earth, fire, water, air and ether. Okay, and we go back to again. Type 1 and type 2 diabetes, I say. Those days they call is diabetes insipidus and diabetes mellitus. Insipidus mean this type 1 diabetes, you can't predict. Lot of water, they have polyuria and water content is much bigger than the sugar, and it's called diabetic insipidus. Diabetic mellitus mean the water content is less and sweetness is more, and that's what those days they call, but don't call them now. Then they call type 1 diabetes and type 2 diabetes. Okay, and symptoms of diabetes. What are the symptoms of diabetes?
Is one of them you're born with, the other one you develop?
Yes, sometimes type 1 can born with, or later on time you can develop an yeah, and
type P is congenital, so you just develop it.
Sometimes it's a congenital, and the baby born with the diabetes, especially the mother got a diabetes. But juvenile diabetes, that called juvenile diabetes. Juvenile diabetes is hard to cure, and it is, they give you 30 or 20 years to live, but it's again myth. The juvenile diabetes is most probably have a mother is undergoing a lot of stress during the pregnancy, or a lot of emotions, and I have juvenile diabetes patient of mine, the little girl, and her mom and dad gone through divorce, and she was when she was in a tummy, the child was in a tummy, and the mother has to go loads of tragedy, the horrendous divorce, and the baby comes with the diabetes, and then she said, and even she said this link is the girl is really angry girl, and she said, I don't know how this anger came from, where this anger came from, this girl, what mother has felt and all carry through that the baby's molecules and come out with that kind of a lot of symptoms, and because she's taking the lot of responsibility over that, and she bring the girl to me, and she said, I know she is very good, very she's a millionaire kind of person, loads of money, and she give loads of money to the stem cell development to the diabetes, she said the science can do something, stem cell treatment they have that new kind of method of treatment, and she wanted to cure the child anyhow, and then I said this thing you can do in Sri Lanka. I have no inpatient wards or something to keep the patient, and again it is quite dangerous, the child can come to coma very quickly, it's insulin, and I can't take that much of risk, it's and she said it's a lot of emotions can carry through this liver, spleen, where in the Ayurvedic way the anger is sustained in a body, liver, spleen and gallbladder, these three, pitta,
Pitta organs.
yeah, pitta organs, pitta, the other pitta, what do you call the Panchabhutagni is affected. Is the Jataragni affected? Is easy to cure. What is the Jataragni affected dosha? The imbalances, gastritis, and the IBS, the other related, bloating, wind, that kind of thing, and ulcerative colitis and colitis, gastroenteritis, and this kind of thing is not like diabetes, is it? It can cure. But diabetes, when you come to, because it's a completely Panchabhutagni is the one affected, not Jataragni, and that means called severe in that case. Okay, and if you don't have any questions, no. Okay, yeah.
Sorry, just a question. Is it in type 1 diabetes that the immune system attacks the
Yes, yeah,
pancreas? Right?
pancreas, yes, because it's, I will come to that point in that, because it's like autoimmune.
Yeah. So it's a pitta disorder.
Pitta disorder. Completely, this whole thing is a pitta, but coming like a kapha disorder. The diabetes, if you ask, what is the disorder? It's a kapha. But we are starting from pitta organs. Very interesting, is it? You know, it is like kapha disorder, and pitta is the one, the starting point. Okay, and coming to the symptoms of diabetes. Typical symptoms of type 1 diabetes is feeling very thirsty. When type 1 diabetes, you know, like is sudden onset. Type 2 is long onset. You know, like type 1 is like suddenly, like everything is coming, kicking off everything. You are very thirsty, you're losing weight, you're feeling, you know, the blurred vision, feeling very tired, and weight loss, and this whole thing is come like within few weeks. The person is good and then lost 10 kilos, and tiredness, and passing urine a lot, and this kind of thing is like very onset is really quick.
And it's very dangerous as well.
Dangerous.
I mean, it happened to a colleague of mine at work. Her son, she thought he would just have the flu, you know, was unwell.
Yeah.
But he nearly died,
Yeah.
literally, and it was diabetes that was the cause, and
Yeah.
it just happened really suddenly.
Yeah.
And he nearly went into coma. You know, it was really.
That's
awful.
really have to, children's you have to identify it very quickly,
Yeah.
because if child is passing urine a lot, more than 10 times, and lose a lot of weight within few, even they have a flu or something, because in the second complication they have like a flu, mother's thinking this is a flu, but it's not flu, and then until they go into coma they can't understand what has happened, you know, like, and because you know, as a mother you don't really think your child is going to have diabetes, you know, because it's the children, you know, and that is one kind of thing is you have to be very careful about the children losing weight, and you know, polyuria is urine passing a lot of time, we call polyuria, and polyuria happen, you have to really check the blood sugar very quickly. Okay, and then and complications, you know, like if diabetics type 1 complication is different than type 2. Type 1 complication, hypoglycemia very quickly. Hypoglycemic mean, what is hypoglycemia mean? Yeah, blood sugar. Yeah. Hyper or hypo. Hyper mean blood sugar level very high. Hypoglycemia, blood sugar is very low. Both sides can make a coma. You know, the coma mean the glucose level to the brain is reduced or overflow, and both way you can have the coma. Diabetic coma is really popular in hypoglycemia than hyperglycemia. Why? The hyperglycemia people can feel it. Hypoglycemia is again sudden. Hyperglycemia means glucose is you know, too much glucose, and at that point patient have similar kind of symptoms, you know, I'm tired, you know, like I can't see, and you know, this similar diabetic symptoms comes, that means they feel like my blood sugar is very high. Blood sugar low one is like is sudden, I fainted and I have, you know, like there is no predicted headache or anything like that, is fainting and then going like suddenly within 5 minutes down, and it's very easy to cure. What is you have to do? Sugar, chocolate, you know, and the chocolate is the very good thing. Why is chocolate is very good than sugar?
Goes into the stomach.
Ashokari, no, because of the like alcohol.
Because of stimulation.
stimulation, and
Because
it's a penetrating through the, and when you put the chocolate into tongue, what you feel like? Ooh, like a pain in it. You see, like feeling like, oh my God, is my whole body satisfied? But if you put the sugar in your tongue, it's sugar. It doesn't give you that the pain in it, and then ashukari we call is very quickly going through, and that's when diabetic coma is a very good thing to have chocolate.
If the patient is hyper, what can they do to reduce the sugar?
Hyper is
Yeah.
insulin. Just put a
Insulin.
insulin, and that the thing is, at that point they give you the under the tongue tablet sometimes, insulin tablets sometimes you can get the high dose of glibenclamide or something like that, some kind of, and many, because you don't have to go to that far, you can manage. But people bad is going to hypoglycemia. Hypoglycemia is like people good going, because people are doing dieting, people having regular medications, and they go into exercises, and suddenly they are regulating their blood sugar level, and when you have metformin or something like that, it's drop the insulin. My father has a lot of hypo, because he's thin and he's active and he's good diet and he's doing exercises, and sometimes when he have the metformin, his blood sugar is come, and he has chocolate in all the time, like when he knows he's like getting a little bit of dizzy or something, chocolate and 2 pieces of chocolate, and that's the only time he's using chocolate or something, and then he feel like sorry,
Medicinal chocolate.
medicinal chocolate. My mom says like he's like he knows diabetic more than a doctor now because managing himself, and like that, again, that are the kind of people who has like lean body and then lot of activities and go for walks and go for like a pretty healthy life, and especially having a massage. The other thing, you have to be really careful when you have a diabetic patient who is pretty good diabetic patient, like who has taking medication and who has doing running and doing all the dietary habits and dietary the regulation, and when they come into have massage, you have to ask, did you have your metformin or diabetic tablet in the morning? After that, did you eat anything? If you don't eat, what happen? We give it, and the relax is vata circulating, and that means circulation is like to and that means the you feel like you can not give a coma, but you can feel like when a person get up and they can fall down, they feel very dizzy. You got to be careful when you have diabetic patient. If when they come into the massage or something or panchakam, you have to ask them, did you have a good meal? And everybody should. Everybody must have 2 hours before some good meal, but especially diabetic patient, you can ask that question to prevent having that kind of injuries in your place. Okay, and blindness, some loss of vision and blindness, kidney failure, lower limb amputation, that's what you're saying, cardiovascular disease, stroke, diabetic retinopathy, kidney disease, foot problems, sexual dysfunctions, miscarriage or stillbirth. This whole can happen as a complication, and I will tell you when you go into Ayurvedic side how is happening. Okay, because they can't explain that, they're saying this happening as a complication, but Ayurveda, when you go to dhatu level, you can say what kind of things appear in each dhatu when you have diabetes. Okay, and children, the childhood diabetes, mostly the children are overweight, and this is not the what you call the congenital one, people born with, because of the lifestyle choice. This one, childhood diabetes is now kicking off in here, because all the children are overweight, and overweight mean what is that? Is dhatu, fat, and mansa dhatu is excess, and that is like with sugars. End of the day, all fat and carbohydrate with sugars. End of the day is with sugars, and that is happening to children, and again, the interfamilial marriages, that is like it is because of the diabetic, some kind of gene thing is like can if a father, mother side diabetic, father's diabetes, and this whole thing is coming together and giving you a better chance to your child to have a diabetes when you have the family histories has that kind of thing. Main symptoms, again, feeling tired, urinating more frequently, particularly at night, feeling very tired and thirsty, and loss of muscle bulk, and itching around the genital area, regular boost of thirst, and this kind of thing. And like all things I will explain again, going to the other level, why is happening, okay? But they don't say why is happening, they say these symptoms can happen, tired, loss of weight and bulk weight, losing, and genital area, why genital area is, like itching and stuff. Sugar is inviting all the fungus. Yeah, and then that is because when you urinate all the time, is sugary urinate is staying in that area quite a lot, like because it's a male, female, both is like it's kind of open kind of space, and it's a little molecules, and that's inviting a lot of bacteria and virus, and especially fungus and thrush kind of things can happen, blood vision and slow healing, cuts and wounds, and everything is going to be slow. When to seek your medical attention, like what time you have to go to doctors, and if nausea, vomiting, temperature, stomach pain, and this is the diabetic patient. It's not like this identified diabetes. Identified diabetes is different than diabetic complication comes. Identified diabetes is like you going to urinate a lot, you have polyuria, and you kind of tiredness, and you feel like a lot of tiredness and polyuria is the one, two things you can identify. And then if somebody has diabetes, and if these symptoms appear, you have to go to the doctors to have a medical attention, like loss of appetite, nausea, vomiting, high temperature, stomach pain, and fruity smelling like a breath, and then urine is smelling like sweet smell, and this kind of thing appear in a diabetic patient already, and they should go to doctors, because further complication can happen, and because this is feeling like this, your diabetes level is gone, the sugar level going high, and it's affected to other areas, and go and see your doctor,
Because it can happen if somebody thinks that they've got diabetes and they're managing it just with their diet, and then they find that actually their diet isn't enough. I had a friend that had that fruity smell because it got out of control. Because they thought they could manage it, but then they couldn't. That's because diet also you have to carefully go, like Western diet is not useful at all whatsoever. They say eat lot of salad and eat little bit of fruit, and eat lot of salad is completely different than Ayurveda says. Eat lot of fruit and don't eat salad, and this is with that you can't manage, kind of thing. And I know the Ayurvedic, when I was in Ayurvedic hospital, the diabetic patients are there. Their diet is like, I have to go and check it all the time, like their diet and different than the other. It's a all hospital, free hospital, and they have red rice, like a hard grain, like rice, very hard to cook. Long time you have to cook, and it's a slow releasing, very kind of with the outer coat is really thick, that kind of rice, and half of
thing is like a gotukola, but not a gotukola. There's katururunga. You know, like it absorbs a lot of what do you call sugar in there. It's a very bitter, you know, and it's half a cup of that thing with the coconut, and then we'd make like a, you know, cook one, not half cook, not the cook very much, and 50 or 150 grams of meat or the fish. Normally it's a fish, and then some kind of vegetable without very much fat, you know, like coconut thing, and pick half of after that half a fruit of papaya. You know, that's their diet, and then I think it's like a really good diet to you know, like absorb all the sugar.
So they eat the red rice, they don't have white rice anymore.
No, the diabetic patient we don't give white rice.
So they have the red rice.
Red rice, yeah, red rice. You know, red rice means brown, dark brown one. You know,
Oh, it's not the red.
red one, dark brown, both is good.
Oh.
Yeah, and in Sri Lanka, you know, we call this a red rice. It's like a dark brown one. It's a very red. You know, like your jumper kind of. The Vivian's jumper kind of thing. You see, the very red. And when you wash the rice, you can have like a paint is going sometimes, you know, because it's the little bit of red is going from the rice, you know, and it's very diabetic people in Sri Lanka always eating that rice because they knew this is the good rice, you know, kind of thing.
Is it
And
available here?
Here, yeah.
Because
Available
it's
in-
slow releasing sugars.
Yeah, sugar is slowly releasing, and then it's kick start to the pancreas. They give you the very, you know, like staying there. You digest me, please. You digest me, please, kind of thing. And then anyhow, the pancreas is identify this process, because if you have so much of something, you know, like so much of carbohydrate, glucose, and pancreas is like, you know, like not identifying it properly. And slow releasing carbohydrate mean it's like a process is gentle. It's not like invasive with loads of sucrose, glucose, and the carbohydrate. It's like very slow. You know, and that means it's like person can understand, you know, the system can understand much more, and it is kickstart the insulin sometimes, you know. And this is investigation, urine test and blood test they can do. First, where the urine test always. Sometimes you can have sugar in urine, but you can't have sugar in a blood. You understand? You have had that kind of result. When you have the, you know, when you predict the diabetes, like a patient, you go to your doctor and say, I think I have diabetes, and then they ask you to have a urine test. If you have a present the glucose in the urine, but they ask you to go through the blood test. Sometimes blood test comes negative. Why? The only urine, or the only. It's like the excessive, you know, like it's like an alcohol thing. You know, like it doesn't go through dhatu level because of the people are using fruit sugar a lot kind of thing. It is present in the urine, not going to the blood level, and some it is the sugar level in a blood is not enough to predict diabetes yet, and they think that one is pre-diabetes. You know, they're saying like when you have diabetes, the urine is diabetes. You know, the glucose present in the urine is that stage called pre-diabetes, and that means you have to be careful and you can get away from the diabetes. And if you have glucose in the blood and you have gone to the other system, and then the lot of people who has diabetes is a pre-diabetes. It doesn't go to the blood level. And gestational diabetes, what is that? And person during pregnancy, people can have diabetes. Why is that? And it is like same thing, like it's present because of the foreign body is there. Your child, the insulin, the whole thing has to be work quite hard, like a protein, carbohydrate, and all the things, Jataragni, the Panchabhutagni. And then sometimes you can feel like temporary your insulin is can't identify what's happening, the big, like what you're saying, like red rice situation, and suddenly there's a bombarded by two people's, like carrying, like especially the when you have the gestational diabetes, what happened? The mother is okay, child is the one put on weight. You see?
Yeah.
Child is the one put on weight because it's like mother's dhatu is like anyhow just taken out everything from the system. The child, because child is not going to be urinate, or this system is not work properly, and that means seems to be child get a lot of nutrient inside the tummy. And most gestational diabetic, the complication is the child going to be big, and then you have to have cesarean, and as soon as the child born, they have to give the child a dose of insulin, because his pancreas is activated to like overflow of that protein, carbohydrate, whatever the molecules are there. That means they give a dose of insulin as soon as the child is born to manage and as soon as the child deliver the mother deliver the child, what happened to the mother? All the diabetes going down, and it's okay, And gestational diabetic is like something else. You may have to really focus and learn a little bit more, and then a lot of mothers can prevent from the gestational diabetes if you have a good diet, And treatment, no cure, unfortunately. And but it's not Ayurveda, but aims to keep the blood glucose level normal as long as possible. And type 1 diabetes, like what the treatments for the type 1 is called insulin dependent diabetes, because it's like without insulin is not functioning, and they have to give an injection orally, or taken some insulin orally or injections. And type 2 diabetes, metformin, sulfate they call, and insulin and diuretic. I don't know why it's this is diuretic. No, metformin. This is the second one is a glibenclamide we call, but it's a different name, and it is a kind of diuretic. Why diuretic? Why diabetic people can give a diuretic?
Because they always have retention of liquid.
Get rid of the sugar.
Get rid of the sugar, and because the diuretic mean like polyuria. If glucose is saturated in the system, and diuretic make you thirst and drink water, and from that you can get rid of the lot of sugar, and that's the reason the diuretics. And good diuretic in Ayurveda, what it is?
Coriander water.
Coriander water. Cure. And one of if you go to website, like I yesterday I never seen something come up, and I had to say some kind of person's testimonial, and his father has a diabetes, and he said it's very simple, the treatment is a coriander water. I thought this is like it is simple, because it's a diuretic, and
And
the-
reduces it.
it increases pitta, and it is good for the liver, spleen, and gallbladder to function properly and take the heat out, and diuretic and cooling, and that means what else we need? And that guy said, pretty simple. Yes, pretty simple. And why do we have to have the metformin and this, that, and I don't know, this whole thing is going, is like out of control now, and reading the sugar level in blood, and these are the, I said to you, these are the measurement they say, HbA1c kind of level or something like cold, but don't worry about this. Here is a measurement, is people say 7.5, 6.5, 16 and 20, and 7.5 to 16 is indicate diabetes, 7.5, and normally patient come in and say to you, my blood, the glucose level 7.5 to 10, and it's not that bad, drug dependable, and then you can cure. And then if somebody say my diabetes, the sugar level is over 16, but still do something, but you have to be careful because the patient's already in a margin of diabetes, it kind of severe. And if somebody said to you, my doctor said, first time my blood glucose level came 7.5 and I am diabetic or pre-diabetic, they want to see me for a while, and that is the best place you can cure the diabetes, because 7.5 mean the pancreas is still working, is given you like a warning, I'm fed up of you because you're eating so much of this thing. And at that point, if you really catch the diabetes, you can cure in a 7.5. But it doesn't mean like person come with a 16 or 7.5 and a 10, you still can manage. You still can give a good diet and carefully, but never ever say to patient to stop the tablet. Okay, never say to the patient to stop the metformin diuretic. But diuretic you can get it out. You can ask the patient to, without a doubt, diuretic you don't have to take coriander water, and one tablet you can cut down without any hassle, diuretic. Okay, and they call it water tablet. Okay, the patient knows it about that, and they call, I have a insulin and water tablet. And water tablet you don't have to have because you can straight away prescribe the coriander water. But metformin, if you wanted to cut down the metformin, they have to have their diary, and the hospital will give them the meter to check how much your blood sugar is morning and night by putting by one drop of blood, and you can predict the blood glucose level. Okay, and
What's a normal level, by the way?
5,
5.
yeah, less than 4.5, 5 is normal.
5% is normal.
Yeah, I mean in here, everybody now, if I see the glucose level, might be 5.5 or 4.5, 5.5 with kind of thing. Soon as you eat your food, and it can go 6.5. Okay, because it's a normal again. And but if you go, because when hospital check your glucose level, they have to have fasting blood sugar. Fasting blood sugar means 8 hours you can't eat or drink anything, and go to your doctors and give the blood, and fasting blood sugar. Fasting blood sugar has to be 4.5 because you don't have any food. You see, 4.5 to 5.5. If you have fasting blood sugar, that's what his prediction has to be. 4.45 to 5. And if fasting blood sugar going 8.5, 7.5, 9.5 is you have blood glucose and you have diabetes, kind of thing. There's always, the doctors recommending your fasting blood sugar to predict your levels, because otherwise through urine you can't really predict the sugar level, because you feel like you're pre-diabetes or diabetic or you have diabetes, but you can't predict your levels very much, and you have to have always fasting blood sugar. And before patients being prescribed any medication, doctor has to done a fasting blood sugar for patient, and he has to carry out a test for the patient. Otherwise, you can't predict, or you can't give the medication. Okay, and when the patient comes to you, they have reports: fasting blood sugar, urine, and metformin or glipizide, water tablet, how much you're taking, how much you're going up and down. They have a little booklet. The doctors ask them to fill the booklet all the time, but mostly 90% of people don't care, and some people. But we can take that opportunity, like ask this. They give a strips and the machine. Take the strips and machine and take our medication. Cut down the metformin and take your blood sugar level morning, evening, and night. And if it is coming down, you can cut more tablet and more medication, the Ayurvedic tablet, and then after that, sometimes later, you can stay in like without medication, diet control. And that's how we do it, managing the diabetic patient. Okay, most of the time is really good. We can do it, but you have to be careful, not put your hand to a burning fire. Okay, you have to see the patient, see the record, see where the blood sugars level are, fasting blood sugar, and see the patients have strength and the the coping mechanism and trust and everything, and then you can go through with that procedure. A lot of people want to eat and take the insulin, and 90% of patients are like that. They think, oh, whatever, give me ice cream. After ice cream, I can have a shot, and that's what the people do. And that means you put more strain to your spleen and more strain to your system, and that means it's like you can have complication very quickly. And can we have a break and then you come? Okay.